Hey everyone, Jen here. Looking forward to joining you live. Give me a second. I'm going to try and bring up an amazing woman who I have the privilege of interviewing today, Kathy Giusti. I just want to say as we get started, I'm super excited about this conversation that I'm about to have with Kathy. I hope that you all can join us because we're going to talk all things about having cancer, our cancer journeys, and sort of navigating our cancer situations. How are you, Kathy?
I'm great. Great. It's good to be with you.
Same here. Thank you so much for going at this again with me. For those that may have tuned in last time, about a month ago now, we had some technical difficulties. So I'm just super excited that hopefully being home, I won't have any technical difficulties today. Great to see you. So let me start off, Kathy, by just telling our audience, those who are tuning in, sort of what we're here to talk about and introduce you a little bit, and then I'll let you introduce yourself. But
Sure.
I'm sort of just enamored with how amazing you are and how much you have done for those of us who have battled or are battling cancer. So for everyone out there, if you don't know Kathy, Kathy Giusti is a two-time cancer survivor. Yes, two times business leader. She's an innovator and a healthcare disruptor. Kathy, throughout her journey, actually started the MMRF, which is the Multiple Myeloma Research Foundation, which led to an acceleration unlike any other in finding treatments and cures for multiple myeloma. And it's because of that now patients who, may have sort of had a very low survival now have 3 to 4 times the chance of living longer. And I just find that so amazing. You're also chaired the Harvard Business Craft Precision Medicine Accelerator, which is right up here near me in Boston, which is amazing. Again, no surprise, Time Magazine had you as 100 most influential people, and Fortune Magazine 50 greatest leaders. Kathy, I just want to like be your friend and be like you. So I'll leave it at that and just say thank you so much for chatting with me today.
Well, thank you. And right back at you. You've got quite a pedigree yourself there.
Well, thank you. Well, today we're going to talk about your book that came out in February, Fatal to Fearless. And I just want to say, to start off, I found it so helpful. I mean, number one, sharing your story resonated with me. I felt like I was kind of sharing a lot of your experience. It felt like, reading about my life. But also, I think what was so amazing is your 12 steps to helping, cancer patients navigate our very complex, as you say, broken healthcare system. So I think this book is just amazing and it's going to help so many people. So I'm excited to dive in.
Great.
So tell me if you're ready, if there's anything you want to get started.
I am ready.
All right. All right. So, okay. So many of you already know, as I mentioned, Kathy had two cancer journeys, multiple myeloma and more recently breast cancer. And no surprise, none of those experiences were straightforward or easy. But from that experience, you created this book of full of information and guidelines, the to-dos. Um, so I'm going to just tell you that when I was diagnosed, everyone sent me books on
Mhm.
cancer. Some inspirational, some had some information. And to be honest, the one that was most helpful for me was the one that gave me um, just clear guidelines on what to do. I mean, I was a clinician.
Yeah.
I I thought I knew what to do, but I really didn't know what to do. And my particular cancer was unique, just like everybody else's. And so I'm just curious from the beginning, what inspired you to write this book? And was it hard to put it all together?
What inspired me to write it was the fact that I had probably along the way coached, honestly, thousands and thousands of patients. And I'm sure this happens to you too. When you work in the healthcare industry, friends, family, everybody, contacts you because they know you know how to work the system, and the system is a huge challenge. And based off that and having these discussions with people, at the end of the conversation where I constantly ask them the same questions and move them in certain directions, they'd always say, Kathy, like 15 minutes with you, and I now really understand what I need to do. Thank you so much for putting it in simple terms. I finally am breathing and have a little hope. And so that helped me to realize that no matter what kind of cancer you had, the questions I was asking and the steps I was asking you to take were consistent, whether it was a solid tumor like breast cancer or a liquid tumor like multiple myeloma or leukemia. But I think the thing that really got me to write it was the fact that I kept watching the science, and you know this too as a clinician, but you're watching and everything's moving so fast now. When I was diagnosed way back in 1997, it was so slow. Like there were very few abstracts, very few things said at medical meetings. And today, you know, all you have to do is put in breast cancer, even multiple myeloma, and you're getting hundreds of millions of hits, which tells you how much is going on. So I felt like if people, especially patients, weren't in the know and weren't really doing the research, they were going to miss out. They were going to have major FOMO. They could miss a really important drug, a really important trial that could extend their life for a year and maybe get them to the next drug. And I wanted to make sure they had everything they needed at their fingertips.
I think that's just so powerful. And you're absolutely right. I mean, when I research anything for my patients now, there's so much out there. It's hard to keep up. Any clinician, even in their field, it's hard to keep up. And you really need to know where to go to get that information. And as a patient, you are your best advocate.
Mhm.
And I have also a rare disease, right? I have a skeletal dysplasia. When I go to the doctor, half the time they don't even know my diagnosis or they think it's something else. And so you're kind of starting from scratch in many cases. And, out of your to-dos, the thing that struck me as being, and I want to hear from you what you think the top, 3 to 5 to-dos are, because they're all good, but they're all critical. But I'm curious what your perspective is. But for me, it was about finding the right doctors, the right team, because that can be life-saving. And so, because as you said, it's so accelerated in medicine and everyone has their niche,
Yeah.
you have to really find someone that knows the best options for you
Mhm.
and your cancer, your diagnosis.
Yes. So I agree. And the way the book was written, I divided it into three sections. So one is you've just been diagnosed. The second is you're in the thick of treatment. And the third is you've rung the bell and now you're moving out into survivorship. And so I would say picking one from each of those areas. At the very beginning, my comment to patients now, especially because we often find out that we have a hint of cancer or something bad is going on because we've gone to our portal. We may even find it out before our doctors have seen it now because of the way the systems work. And then all of a sudden, when you get in to see your doctor, you're only getting on average 16 minutes with your doctor in oncology. And that's not a lot of time. So I really think that you have to understand where to go to do your research. There are really good sites. So one that I really talk about in the book is cancer.net, which is the American Society of Clinical Oncology. It's written for patients. It's really, really good. And then cancer.gov, which is the NCI, and then cancer.org, which is the American Cancer Society. But I also say look for foundations specific to your own disease. You are right. When you get to the second part, which is now you're headed toward treatment, you need to make sure you've got the best team. And what I explain to everybody is there's three ways you're going to go. One is the community hospital in your area. The second is an academic center. And the third is a cancer center like Memorial Sloan Kettering or Dana-Farber. And what happens with patients is you have to decide which one is going to be right for you based off of maybe you can't get off work. Maybe your insurance isn't going to cover one. Maybe you can't get to the academic center in a city. It's okay. You just have to make sure you're going to the doctor that sees the most patients like you. And then the third part of the book, and the best thing I think that's important to do in the third part, is to really understand that you did ring the bell and everybody thinks that you're supposed to be done now and you're supposed to be out high-fiving everybody, and don't feel badly when you don't feel like
Mhm.
that, because in the back of your mind your body's still struggling. Everybody has moved on a bit and they want you to move on as quickly as they are, and you're not ready. And it's a high time of depression and anxiety, and you just have to be kind to yourself at that point, that you have time to celebrate. Like, pat yourself on the back for getting through the treatment, but also know if you're not feeling 100%, you're not alone. That happens to a lot of people.
So again, I'm just going to share everything resonated with me so much that you just went through. And I thought I was going to talk to you a little bit more about something else, but now I want to just touch upon something you said about, the fact that depression and anxiety is so high in that survivorship period and sort of that immediate post ringing the bell, because, you know, I thought I'm a go-getter. I'll be fine. I'll go back to work. I literally had service a month and a half after, my last treatment. And I thought, oh yeah, I should be fine. And all of my coworkers and my boss and my husband, I think we all thought I should be fine. I was miserable. I barely made it. And then after that, I actually said, you know what? I think I need to cut back. Like, I think I need to take a break from clinical care. But it took me going through 2 weeks of what was kind of hellish to
Yeah.
to realize that. But I felt guilty. I was like, well, what's wrong with me? I'm supposed to be better now. It's hard. I
And
don't think people realize the
yeah,
toll.
and you're not alone. And the other part that's really important for people to note is, especially if we have caregivers on the line right now, the incidence of depression amongst the caregivers is really high as well. And part of that is because like 50% of cancer patients are working, two-thirds of caregivers are working, and they're trying to do the best they can. But, cancer's given them a full-time job on top of their full-time job, and they just feel really overwhelmed and a bit desperate. And so it's really important to find the support that they can, whether you're a patient or a caregiver, and understand it's just a tough journey and you have to do your best to get through it together.
Yeah, and to give yourself that
Yeah,
grace to
yeah,
to,
yeah.
to take that time. I want to talk a little bit too, going backwards a little bit in terms of sort of, your experience when you were diagnosed with multiple myeloma, and I'll share a little bit of mine too when I was diagnosed with choriocarcinoma. We were both young with young. I mean, you had one kid. I had just brought home two, two and three from various countries, and I honestly was struggling. I felt like at one point, like my life was perfect. I had a great job that I had worked so hard to get, a loving husband who I thought the world of. Now my two kids, it was like check box, check box, check box, life is great. And then out of left field, like this happened. And so I found, though, while it was surprising to go through that, I think the hardest part was being a new parent and
Mhm.
having to balance career, parenting, trying to be there for my kids. And so I'm just curious if you have any advice too, being a parent at that time, for parents, because I think so many people right now are getting diagnosed at younger ages. We know this. We're seeing cancer diagnoses at much younger ages. So many individuals are going to be parents of young kids, or in the throes of a very busy career time. So I was just curious if you had any advice based on your experience.
Yeah, so I was 37 when I was diagnosed, and our daughter Nicole was just a year and a half old. And we found my cancer because we were trying to have a second child. And I got referred on to a gatekeeper, a primary care gatekeeper, before I could see a fertility doctor. And he was the one that diagnosed my myeloma. So I was like you, I checked all the boxes. Great job, great husband, new house, whatever. And isn't that just the way
Yeah.
life works, right? So, but I will tell you, I think the thing that got me through most of all was, number one, deciding that even though every stat I was reading, remember, multiple myeloma was 100% fatal. The average lifespan of a multiple myeloma patient was 3 years at best. So it wasn't like, if I was going to die, that was for sure. It was, when was I going to die? Would it be 3 years, or might I beat it just by a little bit? And so my goal at the time was just to make sure that my family felt safe. And I don't know if you went through this too, but there's a little bit of, well, if I'm going to die, like, I just want to make sure that I leave my
Yes.
family in the little bubble they can possibly
Yeah.
be. And so, as you know, when I was writing the book, I had started writing a journal for our daughter Nicole so she would remember me. And while I was writing it, and I talk a lot about this in the book because I think it's really important to do, through my journaling, I started to realize how much I desperately wanted to move on and act like I was going to live, which was, go to the fertility doctors and try to have another child. And part of that was just my North Star. And I say this to everybody, like, when you get diagnosed, it's a moment that you just sit down and go, what are my needs? And the needs are, oh my God, what are the immediate things keeping you awake at night? Who's going to take care of my child? Who's going to cook the meals? How am I going to get to my doctor's appointments? Do we have the right insurance? But then there are your wants. And a lot of times your wants fall to your family. And once I set that North Star that I really wanted to move on and have another child, even if it was at, a high risk thing for me, I felt that was leaving our family safe. I wanted Nicole to have a buddy because I had an identical twin sister beside me all the time. I have to be honest with you. I was so distracted with that goal, with that North Star. It allowed me to keep a little bit of the sadness of my cancer off the plate. And I just kept focusing on the goal. So I say that to everybody, like, if you put your North Star down, it could be I want to travel. It could be I just need to stay in my current job. I want to make sure that my family, knows how I feel about them. It could be anything, but just making sure you focus on that when you're writing and working with everybody makes a big, big difference.
Yeah, no, I think that makes all the sense in the world. And I had that same worry. I mean, I didn't know if I would, end up surviving or not. I think I had a high optimism, and I sort of was just in that mode of survival mode, right? Failure in my head was like not an option, which I feel like you definitely embraced, despite the odds. And so my North Star was my kids. I
Yeah,
wanted, I wanted to be there, and I felt, if nothing else, my kids were also adopted, so I thought I can't bring these two kids here to their forever home and have them lose another
right.
parent. I felt like I was going to do everything I could to prevent that from happening. But it's that North Star that keeps you
Yeah,
going. I love that.
worry less about yourself because you're really focused on those around you. Yeah.
Exactly. Exactly. It's so true. Oh, well, okay. So I want to keep hearing more. Okay, so I'm gonna go to maybe a tough place, because I thought your book also resonated with me so much in terms of sharing your story. And you are just so tough. And people would tell me that when I went through my cancer journey, I was so tough. I don't know if it's really a matter of being tough for either of us. I felt like, no, I'm just doing what I need to do, to survive. And the goal is, like, again, your North Star. That's where we're headed, and that's the focus. But there were times when I had, like, dark moments or fears. And so I was just curious, because at the time I almost was afraid to share some of those scary moments with my husband, with anyone. I mean, it's almost like I couldn't speak the fears, because I was afraid if I said it, it might be true, or it might come true. And so, most of the day, again, focus on that North Star, going, going, going. And then at night, usually when I was alone, maybe I was dealing with, night sweats, or bone pain, and that's when I would just go to these dark places. And so, how did you have those moments? And if so, how did you manage them?
I did, that's what I call not knowing when to sound the alarm. Because, in any cancer journey, what happens is things that might just be happening to you anyway, night sweats, not feeling well, stomach pain. I mean, it could be anything, right? We immediately go to the, oh my God, my cancer's back, I'm dying. And so I think the most important, cancer patients and the caregivers can do is to acknowledge that sometimes you're going to a dark place for nothing. So until you actually have the information, do your best not to go to the dark place. I would go through this, as I mentioned before, I have an identical twin sister, and a counselor did say to me at one point, your husband's going to be an amazing caregiver, but make sure that when you get to the tough stuff, that you have somebody else to talk to. And often that would be my sister. And ironically, my twin sister ended up with stage 3 breast cancer. And I remember she would call me, and it would be like every time she went on the portal, you know how this works. You get certain test results back, but there's always something that's wacky. A liver enzyme went up, or your hemoglobin went down, or there's always something that you're reading into it. And so you have to say to yourself, don't sound off the alarms yet. There's no need to do it. And just get the facts and check it out, and then decide what you want to do about it when you go to those dark places. So that's one thing, is know your information, ask the right questions. And by the way, another tidbit of information for everybody on the line is, when you get information back on your portal, the fastest way to get an answer is to email right off the portal, because now you've got something in writing. And a lot of the offices really do keep track of all the questions that patients.
Yep.
So that's a really good way to do it. And the other part is, just make sure you have other people to talk to when you go to that dark place. It could be a sister, it could be a really good friend, it could be a partner, but make sure you take the time to talk with them. And if you're really struggling, then you will need to find a social worker or somebody to help you.
A
Yep.
professional person who can get you through that tough time.
Yeah.
Yeah, it's so important. And I think, again, and I think I heard this in your book. You just don't want to burden other people, because you feel like you've already have so much going on, and appropriately are relying on your system. And it's hard. I mean, you had your 8 friends in addition to your family. I love that, by the way. And if I have to go through this again, I'm gonna find my 8 friends.
You could find one or two and you'd be fine. And I think the reason I included a lot of that in the book was it looks like I had absolutely everything going for me. I did. I had great insurance, a good job, a good husband, good kids, great friends. And yet I still screwed it up. And that was kind of the point of the book is like, if you feel like you've messed it up, you are not alone. I had the
Yeah.
perfect background to have a perfect journey and I still didn't do it right all the time.
Well, who can?
I know.
Who can? Well, let's switch hats a little bit and talk a little bit about the healthcare system. You obviously have done so much work navigating with creation of the MMRF and all the work that you've done, with the Harvard Business Accelerator, Precision Medicine, working under presidents for, helping them to, achieve their goals for cancer care and research. And I'm so impressed with that. And what's, I think what's hard is that, and what I've learned from reading your book is reading your book reminded me of all the things that like I've experienced either as a clinician or as a patient, and you put it into such a clear, organized, succinct way to help guide patients. And it's not just for cancer, it can be for any medical, I think, illness in terms of the 12 steps and how to approach a diagnosis. But, our healthcare system really is complex and it's really broken. And what I would always like, I now help care for my parents, right? And my own kids. And I know my parents every day are like, thank goodness that you're in the family as a doctor because you can help us navigate it. I don't know how patients and families who don't have someone in medicine in their family navigate this. And so I'm curious, again, what are your perspectives on how broken our healthcare system is? And is there a future where it can be less broken?
I think it's unbelievably broken. I think the pressure it puts on the patients and the caregivers is incredibly high and getting higher and higher. And the reason I say that is because of how we started this conversation. When the science is as good as it is today, when there is as much hope for curing some of these cancers or finding these cancers early, just as important, then it means that we have to be on our game. And there's no way that a single community oncologist, despite how hard they work, is ever going to be able to stay on top of every cancer and all the scientific progress we're seeing in that cancer. So since it's your cancer and your cancer, even within your specific type of cancer, is going to be very precise, you have to know it better than anybody. If you don't want to learn it, then you have to find a caregiver that's willing to go online and help you find it. The biggest gripe I have with the medical system is the pressure it puts on the patient to identify the right team and to integrate it. So you and I both know this. Like, I go through a stem cell transplant. I'm 37. I didn't even know. I never went to an OBGYN. I didn't even know it was putting me through menopause. Like, high dose chemo will do that. I didn't know when I took certain drugs that it would destroy my teeth, my jaws. I got osteonecrosis. I wish somebody had sent me to a great dentist. Like, even within the whole system, like, we have to sit there and go, okay, I need to see a surgical oncologist, radiation oncologist, the pathologist, eventually get my surgery and physical therapy. Like, we integrate it all. It's
It
exhausting.
is.
And for, again, 50% of patients still working and 2/3 of caregivers working, there's no way to help this. But the one thing I'm positive about is the fact that Medicare is now covering navigation. And I do think a short-term fix to our wacky medical system is navigators. And so if we could, because I feel like that's a little bit of what you and I do, right? We navigate.
Mhm.
And I feel like the book is a navigation tool. So I think the frustration for patients is how much time it takes doing the research to find who do I want to see, where's the office, is my insurance covering it, and if I need emotional help, where am I going? So that's what navigation's all about. And I think if we can improve that part of the system, we'll go a long, long way.
I agree. I agree. And I think along those lines, I have this dream that as well, like as we're trying to focus and develop precision medicine, we're developing precision teams,
Yeah.
right? Because healthcare is a team sport, and I think the lack of collaboration, and that's actually something that one of our audience members, asked about before, how can we improve collaboration? And to your point, a navigator can do that. And I think, and maybe this is happening in some areas, but the clinicians that are all involved with the patient need to meet once, I don't know, once a month or something. And like, let's share, where are we going? How are we moving together? Are we rowing the boat in the same direction? Are we supporting the needs of our patient? And that, to me, we need to start to make time in our infrastructure to support that, funding, meaning, and time, so that our clinicians can actually talk to each other.
Yeah, the doctors don't have any time. So I can't tell you how many times I would, when I was coaching a patient, often help them to get the referral. I would often have the doctor's email. And then I would build a team for them. And I would just do an email and say to everybody, hit reply all. The doctors don't always love it because it's just another time sink in their incredibly busy days. But if you want to keep everybody integrated, using the email system is not a bad way to do it.
That's a good idea. Yeah, that's a very practical tip that we could do now.
Yeah.
And then just CC everybody.
Just have
Yeah,
to.
yeah,
At the point you're just waiting for them to respond. So I know it sounds crazy, but it's a good way to go.
absolutely. And use your patient portal
Yeah,
that's available to you.
portal. And then the other thing I always say to everybody is know the foundations, know the websites to go to. But there are medical meetings every year, and these are the meetings where all the latest science is presented. So if you have a solid tumor, prostate cancer, breast cancer, colon cancer, much of that is being presented at the American Society of Clinical Oncology in the spring now. And then the liquid tumors is always, in early December. It doesn't mean you have to go to the meeting or read every abstract, but all the foundations, all the press, everybody will be writing about new scientific advancements going on during those medical meetings. So just know when they are. You can put in your form of cancer and say ASCO 2024 in your form of cancer and Google it, and stuff will come up that will help you stay on top of the science.
That's great. This is so helpful and so practical. And it's a shame that, it's a shame that it took so long for, like, this to come out there. Thank you for doing this, because this is what everybody needs to know.
Thank you.
So, okay, so I want to ask a little bit of a, also related to your work experience. I think there's so many of us that have a cause that we're interested in helping to make better. Want to step up. Maybe some folks want to create a foundation. Maybe others just want to help be an advocate or make a difference in that space. And so I was just curious if you could share a little bit about how you were able to, especially during your diagnosis so early on, sort of do that, take that transition from WTF to WTD
Yeah.
and create a foundation that, I mean, it's I don't know, it's an exemplar for anyone looking to start a foundation. I want to know how you did
Yeah.
it.
And I'm sure like people listening, it's so hard to take on starting a foundation, right? So I always say to everybody, you don't have to start one. Like that is an all-encompassing part of your life. I had a great background to do it because I had a business degree. I'd been in the pharmaceutical industry. I kind of knew how to take something like that on. But what I do say to all patients is, if there is a foundation or even the rare disease groups or whatever it might be that is involved in your tumor, get involved. So it can be as simple as they're doing a race and you want to build a team. The reason I say that, or go to their seminars, listen in on their webinars, like they offer amazing information. I can't tell you how underutilized some of these disease groups are. They have so much to offer. And so get involved with them. You will meet other patients like you, other caregivers like you, and it'll be more fun for you. And you'll be in the know on all the progress by talking with everybody. So if you want to start a foundation, you can actually, I put everything I ever learned about running a foundation on the Harvard Business School site. So it is under the Craft Accelerator, which we can put in notes.
That'd be great.
I business plan of how I wrote, worked at the MMRF, and it's super helpful. Every Harvard Business Review case we wrote, every article I wrote is all on that one site. So I felt like if you wanted to start a foundation, go to the ABS site, and if you were a patient, go to the book, and at least that way I could try to help as many people as possible.
That's amazing. That's great. It's so important. And I'll tell you my secret foundation I wanted to start as a new parent. I didn't really share this with many people, and obviously I didn't start it, but that's okay. Maybe it's never too late. I remember trying to get back and forth to appointments and thinking about grocery shopping and taking my kids places. And again, I was like, how do moms do this? Maybe single or don't have family infrastructure near them. And I thought, we need to have a service where people can just go run errands for parents. Like I wanted the mom errand band to help with kids, but never started it. That's okay.
Yeah, it's so tricky. You have to go to your own community and see if you can get people to help you.
Yeah,
And not easy to ask, but you know what? People really don't mind helping. I mean, they're really glad to do it.
I know. I did realize that, and that was also hard for me to accept the help. But that's a lesson that I've learned as well. It's okay, and we need to do that.
Yeah.
So. Well, so I know we've been chatting for a while, and I could keep chatting forever. I do have one more question I'd love to ask you, sort of moving past diagnosis and then more into recovery. Um, you know, what are your recommendations? And we kind of touched upon this, but to help, one of our audience members really asked about the anxiety with monitoring, screening, surveillance. After you've completed your cancer treatment, now you're in survivorship. For example, recently I just found three new lung nodules incidentally. And of course, like my
Mhm.
brain went to the dark place. How do you manage and recommend others manage that anxiety when it
Yeah.
comes to post cancer?
I think knowledge is a powerful thing. And I think that the testing that we have now to identify how deep of a remission a patient is in is really getting so much better. So now we can do what's called MRD negative and say, okay, you really are in a deep remission. I think knowing and staying in touch with your oncologist is critically important so that if you do relapse, if something happens, they can catch it like this again really quickly. And I think while you're doing that and understanding the knowledge, you have to remember that new treatments are being found all the time. So yes, you want to be worried about it, but don't worry until you have information to worry about. And secondly is remain hopeful on the amazing science that we're seeing in this country today, and do everything you can to stay on top of it.
Yeah, I mean, it's overwhelming how much the science is accelerating as a clinician, but it's
Good.
very good from the perspective of
Yeah.
patients. It's so important. So,
Yeah.
and obviously you've played a big role in that. Well, lastly, Kathy, is there anything that I haven't asked you that you would like to share before we wrap up? It's been such a pleasure, and I'm learning so much.
I think the one thing that's the most important is to not give up hope. So, I mean, here I was, 37, 3 years to live. I mean, and it was no ifs, ands, or buts. I was going to die. And the fact that I've made it through, and in the world of multiple myeloma today, we've tripled, quadrupled the lifespan of these patients. It is a really hopeful time. And so don't give up hope and make sure that you're doing the best you can to be compartmentalizing, putting some of this stuff over here, the information, the data in your portal, and trying to make sure you're living your life while you try to save your life. It's a balance, and I think I struggled with that all the time. Like, how many hours do I put into saving my life and saving other myeloma patients' lives versus being next to my children that were getting older. And I feel like we're kind of like the stay-at-home versus working mom on steroid kind of thing. Because basically you've just been handed another job.
Yeah, you're right. You're
Yeah.
absolutely right. It's another
Oh,
job.
oh.
What's
Like we all
that?
stay at home and we want to work, and it's and illness on top of it. It's not
It's
easy.
not
Yeah.
easy. I know. Yeah, no, my oncologist, she said you're gonna need to take a break from work. And I was like, no, I'm not. I'll be fine. And then, a couple treatments in, I was like, okay,
Okay.
this is kicking my butt. You're
Mhm.
right. I'll take a break.
It's okay. Take a break.
Exactly. Oh, Kathy, this has been so wonderful. I've learned so much. And if anyone out there has not yet read your book, please read your book, a bookmark it, because it is not only something that is just so powerful to read, but it's also something that you want to save and bookmark, so that when you're at that stage, or if your loved one or someone you know is at a certain stage of their cancer journey, it's unfortunate, but probably all of us here are going to be touched in some way or another by cancer. And use the book. It's so helpful. It's so practical, and it's really important for it's life or death. It's surviving. It's making it. Finding your cure, finding your team, finding your support. All these things that are important.
Thank,
Thank you.
thank you. And thanks for spreading the word. I really appreciate it.
Oh my goodness, absolutely. All right. Well, hopefully I'll get to see you next time you're in Boston.
I would love that. That would be great.
Let me know.
All right.
Okay.
Take care. Bye
Take
bye.
care. Bye bye.